In the December 2019, there was a cluster of pneumonia cases in China. Investigation found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now may change in the future. Coronaviruses are a large group of viruses. They consist of a core genetic material surrounded by an envelope with protein spikes. This gives in the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal system. Respiratory disease can range from the common cold to pneumonia. However, there are some types of coronaviruses that can cause several diseases. First, SARS-CoV in China in 2023 and the Middle East Respiratory Syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who had been associated with a seafood market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are hundreds of cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animal to human. This is called spillover and could be due to a range of factors such as mutation in the virus and increased contact between human and animals. For the example, MERS-CoV is known to be transferred from camel and SARS-CoV from civet cat. The animals as a source of 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamic of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People group most at risk as close contact with animals such as live animal market workers and lose caring for those with infection this virus such as family members or healthcare workers. So how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as coughing, shortness of breath. In most severe cases, there have been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There is currently no specific medication for the virus, and treatment is supportive care. There are currently no vaccine to protect against the virus. Treatment and vaccine are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering mouth and nose after coughing or sneezing with tissue or other, avoiding close contact with those who are sick, proper with masks and protective equipment especially to healthcare settings. Washing hands regularly with water flow. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary contact with animal, washing hands after contact with animal or animal product, and ensuring that animal products are cooked thoroughly before they are consumed. It's important to stay at home if you're feeling unwell, but you favor cook, difficult breathing, seek medical care only. And share your travel history better. That's a quick look at this emergency infection disease. Given that this outbreak is evolving rapidly, what now about this virus can change? Please check the website below for the up-to-date information.